sirs, mayong adlaw. Welcome sa Kidney Transplant Unit.
Good day everyone. Ako si Dr. Maricris Araneta, isa sa mga internal medicine consultant and adult nephrologist sa Corazon, Locsin, Montelibano Memorial Regional Hospital. And I'm also the head of the nephrology unit, which house the hemodialysis and the peritoneal dialysis unit. Actually, damo kita causes sa pakaguba sa kidney naton. But worldwide, the most common cause is diabetes, followed by hypertension, and closely followed by mga hubag sa kidney or what we call glomerulonephritis. And after which, meron kita mga infection sa kidney or the mga pyelonephritis, tagas ng mga uric acid, and of course, yung iba is mga herbal or mga unnecessary use of mga over-the-counter medicine. So, muna sila usually ang mga common causes sa pagkaguba sa kidney ng tao. Depende sa cause na ginatawag sa pagkaguba sa kidney. For example, sa diabetes, we have to make sure na properly control the ating blood sugar by going regularly to the doctor para makapahatag siya sa adequate na medications and proper care man kung gataas ang BP, pag-inom sa mga bulong na ginareseta sa doktor, as well as kung naghubag ang kidneys. The bottom line is actually you have to control ang primary factor na nag-cause ng pagkasaka sa Rhea mo or pagkaguba sa kidney mo. So, if it's diabetes, you have to control the diabetes. If it's hypertension, you also have to take medications to control the hypertension. And for other disease entities like UTI, you also have to take the medications. And of course, you also have to get to the bottom of the matter. Nagabalik-balik yung UTI, nagasilid ka protein sa ihi mo. Because if at first okay lang sila, eventually as time passes by, it will scar the kidneys. And unfortunately, ang kidneys are end organs and highly specialized and they are not actually renewable. So basically, once mag-start na sila guba, hindi mo na sila ma-revive pabalik. Okay, it's very difficult to revive a nephron. Actually, we have not necessarily programs, but we have departments or units rather that cater to patients na may guba sa kidney. And one of our important na unit is the nephrology unit, which we have offer renal replacement therapy in the form of hemodialysis and then peritoneal dialysis. But these are already in patients na guba na yung kidney nila, wherein they can no longer function without dialysis or the help of a machine or fluid to remove the toxins sa body nila. We also have the kidney transplant under the KP unit. This one naman, it's the optimal treatment for chronic kidney disease, wherein you will be given the chance to have a new kidney to perform for you. If usually the best time to do the transplant is within 2 years, wherein you still have a little of your kidney function left. So as much as possible, we try to encourage patients na who undergo peritoneal dialysis or hemodialysis to undergo transplantation if possible, and if they have appropriate donors. And of course, you have to make sure that when you do transplantation, you are able to afford the medications after the transplant because it's imperative that you do, otherwise mag-reject ka, sayang lang sa kidney yung ginagawa mo. We do lectures, preventive lectures, wherein patients will be taught how to prevent kidney disease and of course how to take care of their kidneys by these lectures given by our nurses, dietitians, nephrologists alike, and also other doctors who will also give the lectures during this program. So we don't just treat the CKD, but we aim actually to prevent CKD because ultimately CKD becomes very expensive to maintain, but it's easy to prevent if you can catch it early on. So I think that's about the programs of our hospital. So we have this preventive arm where we do lectures at the OPD, and we also have this treatment arm, our renal replacement unit, and then our kidney transplant unit.
Maayong adlaw sa tanan, ako si Emmanuelle E, isa ka hemodialysis nurse sa Nephrology Unit sa Corazon, Locsin, Montelibano Memorial Regional Hospital. Sa akong galing bilang isa ka hemodialysis nurse, pinapaathag namon sa mga pasyente kung ano din ang best treatment para sa chronic kidney disease. Hindi ni matabo ang ato nga kidney transplantation kung wala kita sang donor or among magahatag sa healthy nga kidneys. So sa mga nagliligan nato yung mga transplantation, no, aton yung mga pasyente nga naghatag sang ilang mga kidneys, nakabalik na sang ilang pang-adlaw-adlaw yung mga ulubrahon. Wala man sila maging batsyag nga kung wala man sila maging batsyag nga mga malain or wala man sila nagmasakit. So sa subong healthy man gyapon ang ilang pangabuti.
Isa ako ka kidney donor sa sulod sa 17 years na. Early 2000, ang akong father na-diagnose sa end-stage renal disease upon ESRD tungod man sa iyang diabetes. So, sa ako itong mga tinuig na dialysis siya for sa sulod sa 2 ka tuig. So, ako bilang bata niya, gusto ko nga may ara ko magulig sa iya in my own little way. So, sa nag-edad ko 18 years old, nagpalapit ako sa iyang nephrologist. Kag voluntaryo ako naghambal na gusto ko mag-donate kidney sa akong father. Kaya nakita ko man ang iyang pagpangabudlay, kag gusto niya pa mabuhi sa Malawi. So fast forward, subong, sa kaloisang Diyos, 35 years old na ako, kag sang nag-donate ko 18 pa lang ko to nang may ara na ko subong own family, may ara man ko 2 ka kabataan. Kag so far mahimo ko man gyapon kung ano ang mga ginahimo sa mga normal nga tawo nga 2 ang kidney. So ang difference lang is isa lang ang akong kidney subong, pero I'm living a normal life kag nagaobra ko sa ospital. So sa tanan nga mga nagapamati kag nagalantaw subong, ang mahambal ko lang is base amo panigani ang ginhatag sa Dios sa aton tungod agud nga kita makabulig man sa iban nga tawo nga nagapanginahanglan.
Ang Corazon Locsin, may ara sang kidney transplant office sa mga gusto magparehistro. Sila ining facility kaga-coordinate sa Philippine Network of Organ Sharing or ang PhilNOS. Nga isa ni siya ka-party sang Department of Health para sa insakto nga proseso sang pag-donate sang aton yung organs.
In relation to our services in Corazon Locsin, we are also celebrating World Kidney Day every year. It is an ISN initiated celebration which happens on the second Thursday of March on a yearly basis. This year's theme is actually Kidney Health for All, bridging the knowledge gap to better kidney care. It emphasizes preventive measures so that we can better prevent kidney disease, not just treat kidney disease itself, but prevention. Because as you always say, prevention is better than cure. And of course, it costs much less than doing hemodialysis, peritoneal dialysis, and kidney transplantation. So we'll be having Zoom lectures for hospital personnel, wherein we'll be talking about kidney diseases in children, kidney diseases in adults, kidney stones, diet in patients with kidney disease, and of course, renal replacement therapy in the form of your hemodialysis, peritoneal dialysis, and lastly, kidney transplantation. So I hope all of you will be able to witness this event, and so that you will be able to impart the knowledge that you have gathered in our lectures, so that you will also be able to share them sa ibang mga tao. After all, we are doing this programs because we want everybody, especially our healthcare workers, to spread the word that kidney disease is preventable, especially if you catch it early.